Hey guys, what's going on? Theron Shan here. I wanted to show you guys a game that I found on Steam that I really think could work well for CIG and as we get into the development of the medical gameplay profession. So, with the introduction of the Apollo medevac ship, players talking about the Cutlass Red, as well as the Endeavour Hope class hospital ship, I, a lot of players have been doing a lot of thinking about what type of medical gameplay are we going to get in the game. How will players be able to scale from the simple tier 3 mechanics of low-level healing all the way up to the tier 1 near death, life-threatening injuries, uh, and different things like that without it being repetitive, without it being too simplistic, but with there being a scalable challenge to it. And I think this game, BioInk Redemption, may provide a really good basis for that. So I wanted to jump into this tutorial and show you a little bit about this game, and hopefully it will spur some conversation. So we're going to choose life. We're going to jump into the tutorial here. I'm going to make this maybe like a 10-minute video, and I may do a couple of extra videos to go a little bit further into the game. So I'm not going to read everything that you see here. You guys can read that for yourselves. But what you can see is you have the patient here, and it shows their overall health. It obviously has all the various systems that the patient has that you can check on. Now, this system uses biopoints, and that's how they kind of enable you to choose which treatments and which differential diagnostic tests that you're going to run on the patient. I don't expect CIG to use that. They're going to have to do something different. I don't know maybe what that would be, but we can work on that in a little bit. So let's get through this really quick. And you can see this is pretty gamey, but it is what it is. It's okay. Macrophage there. Okay, so we're going to go into our biomap, and the biomap is really the heart of, I think, where this mechanic starts to shine. The way that I see this working is that what would happen is a player would end up on your biobed, whether it's a tier 3, tier 2, or tier 1 biobed, it doesn't really matter, but this is where you would start to be able to see their symptoms, and you as a player would go to kind of a terminal, much like the trade terminals, in the various shopping kiosks or the vehicle manager terminals. So here you'll see the player will come up. It'll show you, hey, these are the player's symptoms. And based on those symptoms, you're going to start seeing, as you click on them, different ailments that the player character has. Now, this would work for player characters or NPCs. It worked the same for either or, so it doesn't really matter. So one thing you're going to need to do is figure out how find the affected body system. What is really this patient's problem? And this is really where I think players can really get a lot out of a mechanic like this, because those players that decide to dive deep into this and read up the literature about the various symptoms that are common in Star Citizen, the various ailments, and the various treatments, they're going to get a lot out of this. They're going to end up being those sought-after medics in the game, or sought-after doctors in the game that other players are going to want to seek out, or other NPCs are going to want to seek out, versus the players that just kind of skim over it and give it short thrift. They're probably going to end up killing more players than they save, and no one's going to want to use them. You're going to start getting a bad rep as the Dr. Kevorkian of Star Citizen. So I've gone through this tutorial a few times, so I know exactly where to go, but also in my day life, I'm in the medical field, so I can tell from a person who has symptoms, these symptoms, their issue is probably respiratory. So, okay, so here's where the tier system would come in, at least in my estimation. You can see here that if you only had perhaps a tier 3 um, medical facility, you were maybe in a Cutlass Red, you may only be able to do a stethoscopic exam. Versus if you had a tier 2 bed in a Apollo class medevac, you might be able to do a flu test and a stethoscopic exam. And then if you were in a tier 1 facility like a Hope class Endeavor, you might have something else, maybe a blood test, or well, this is basically what a flu test is, but you might have something else in addition to these two. But for right now, we're going to do a flu test. And we're going to run that test up. One thing that I skipped over is, it'll show you that, the two things it was going to test for was flu and H1N1, which is right here. So you'll see the diagnostic test running. And this is another feature of the type of tier system that you have. And you can see, okay, we can see tested both positive for flu and H1N1. We could have tested negative for either or both of these, which would have had an issue for us. We would have had to gone back and tested for other things. So we're going to treat the patient, do a treatment based upon what our diagnosis was. So we're going to click on H1N1. And again, this is where, as a player, you're able to really, I think, in getting away from points, you may only have so many types of antiviral drugs at your disposal. Maybe because you didn't do a mission, or maybe you didn't go to this planet, you don't have the antiviral drug that treats Tavarian swine flu. You don't have the antibiotic that treats, who knows, this Terran, this one strain of Terran flu that everyone's coming down with. So you really need to know what type of drugs you need for what type of diseases. In the medical field, you can't just throw the kitchen sink at patients. It will actually make them worse, not better. So you may see that if you don't have the right type of antiviral drug, the efficiency might not be 100%. It might only be 30, 40, 50%. So we're going to go through here. We're going to treat this patient's H1N1 and see how that goes. And okay, great. The patient's recovering at 10%. Once they get to 100%, we've cured that patient. Okay, so you can see, and I just wanted to do this quick run through the tutorial. You can see I have 2 more diseases that I need to treat, and I'm not going to do that in this video. I may do it in a separate video to show some additional things, but I wanted to give everybody a quick run through here to show what some of the possibilities are. One of the things that I think CIG could do is, when you get into the tier 2 and tier 1 medical systems, is perhaps you're doing bone graft, not bone grafts, but trying to repair broken bones, or you are going into the circulatory system and potentially doing surgery. Your vena cava, or your aorta. You may have your brachial artery may have gotten shot and it may be ruptured. So you need to do some surgery on that to repair the hemorrhaging. Things like that. You may need to do nerve replacement surgery to fix a paralyzation. Those things can be done through this type of interface, and I think there's a lot of gameplay that can come out of it. I hope everybody liked the video. If you have any comments, please comment about this video in the thread that I'm going to post on Spectrum. Again, this is Theron Shan. I hope to see you guys in the verse.